Hello everyone, welcome to Marketing Techniques to Overcome Occupancy Issues Post-COVID. Firstly, it's fantastic to see so many people joining. Usually what we do in these webinars is we give people just a few moments to join. I can see the attendee list is filling up fast. So whenever you do join, pop your name into the chat and say hello to everyone, and we will say hello back, just so that makes us know that the chat function is working. And also it just gives you a chance to interact with the rest of the audience. So I can see we've got a good amount on already, which is good. Nice, everyone's nice and punctual tonight. We've had webinars where we've had to wait 15 minutes for people to come on, which isn't handy. But just on this is that this is recorded this evening, so we will send a copy of the recording post the webinar. So by tomorrow lunchtime, we will have a recording in your inboxes. So don't worry about writing notes. It'll all be on demand, and you can look back on the content. Again, just to go over some housekeeping, we have a questions box on the right. You should have a little panel, and we have a questions box. So if any questions throughout the webinar, feel free to pop them into the questions box, and we will either stop if they're very pertinent to that part of the presentation. We'll stop and we'll answer them there and then. But if not, there'll be a Q&A section at the end. So I can see that we've got a good amount of attendees. Again, as you're joining, just pop your name into the chat box and say hello to everyone. Hopefully everyone will get me saying hello to them in the chat box, and I'll just show you how to use the platform. So thank you again, everyone, for attending. I will start off then, because I think we've got a good amount in the webinar. So I'm going to start off by introducing myself. I'm Stevie McIntyre. I am the marketing lead here at Locum. Just to give you a bit of background in this, we've been hearing reports that there's occupancy issues and some challenges with occupancy throughout care homes, which I'm sure everyone on this webinar is very well aware of. So I thought, what better way to use my skill set in terms of internally here at Locum in my marketing role to take you through some strategies in order to help with the occupancy issues. And I was very lucky that Issac Theophilos volunteered into coming on and helping with this webinar. So I'm going to hand over to Issac to introduce himself. Hopefully you can find the unmute.
Hi everyone, good evening. It's Issac Theophilos here, a care home consultant, worked with more than 150 care homes so far. So I got some strategies to share with you. I actually prepared the content for 30 minutes, but I have to cut short into 15 minutes. But we will get into it later in detail anyway. Thank you for having me. Locate a Locum.
Thanks, Issac. We also have Jeanette Haire, who's the healthcare lead here at Locum. Jeanette, do you just want to say hello to everyone?
Hello everyone. I'm actually as excited as hopefully you guys are for this tonight. I've seen some of the slides, so it looks really informative, and I'm sure we'll all get something out of this by the end of it.
Brilliant, thanks Jeanette. Okay, well without further ado, we'll get started. And how we're going to start tonight is I'm going to explain who Locum are. Just some of you guys might not know about us. Our vision is to mobilize the world's healthcare workforce, and we do this by making sure you have the right person in the right place at the right time. We actually have 5 products that make up our workforce management suite. On the left, you can see our Rota and Leave product. So our Rota product does enable you to get the right person, the right place at the right time. And if staff are on a Rota, they'll obviously require annual leave. And our Leave product enables staff to submit leave requests and allows managers to track employee leave. And if staff are on leave, it means that there's going to be a gap in the Rota. So our Bank product, which is really pertinent to care homes, it helps you grow a pool of bank workers, and it helps you fill shifts fast by sending notifications to bank workers whenever a shift becomes available, and stops the whole ping pong with phone calls and texts late at night whenever you're trying to enjoy your free time. We also have an expense management product. What that is if you obviously have bank workers or full-time workers, you're going to want to pay them. The expense management product runs a report, and it helps streamline payment processes in care homes. Our newest product is our time and attendance product, and this gives you the ability to allow employees to clock in and out of shifts. We don't actually do any of the hardware. All our software is installed on iPads or laptops, which means that you don't have to worry about paying out for hardware. We also have a reporting suite that It gives you access to full intuitive reports, payroll reports, leave reports, time attendance reports, everything you can imagine. And it obviously allows you guys to make data-driven decisions whenever you're trying to decide on something in the care home. Whew, that was a whistle-stop tour of our product. Hopefully everyone understood that. So if you want to know a little bit more about Locum and what we do and how we can help care homes, then please just do get in touch. And Jen is on hand at the end to answer any more questions about us as an organisation, which is great. So I am going to crack on now with the presentation. So this is the agenda for this evening. Firstly, we're going to look at challenges, sort of explore why we're doing this presentation. Then we're going to take you through awareness, which is 5 marketing techniques you can employ right now to improve occupancy. Then we're going to look at engagement, and we're going to take you through 5 marketing techniques you can employ right now to increase engagement. And then Isaac's going to take us through the conversion strategy, and he's going to look at the CQC compliance and how to convert people who actually are interested in potentially coming into your home. And then obviously, like I said, we're going to end with Q&A. So hopefully everyone finds this informative. How we usually start these presentations is what we do is we try and get a feel for who's in the audience. So what we're going to do is we're going to launch a really quick poll. So if you're watching now, you should see a poll pop up on your screen. And the question is, do you currently employ any marketing techniques to increase occupancy? And the answers are yes, no, yes, we'd like to improve. So if everyone just give you all 30 seconds to answer that question, and then I'll share results to let you know just who's on the webinar, and see if we can maybe change the content slightly to make sure you're as well informed as possible. Just give that a couple more seconds. I can see nearly 60% of the people have voted. Just 5 more seconds, guys, just we vote and we will get going. Okay, that's good. We're up to 90%. Couple more votes. Okay, perfect. I will close it off there. I'm going to share the results quickly. Really, thank you very much for completing that. It's good to get a feel of the audience. So 35% of people said yes, they do employ marketing techniques to increase occupancy. Great. Hopefully I can teach you a little bit more and little things to employ that maybe can slightly improve those. But you might just say, yeah, we're doing all that. So that's fantastic. The 23% say no. Hopefully you'll learn loads from this and you'll come away full of knowledge and ready tomorrow to start implementing some of the things we talk about. And the 42% who say yes, but we'd like to improve. There's always room for improvement with marketing. So thank you very much for that. And like I say, hopefully you guys are all going to love the content we've put together for you. So back to the presentation. Hopefully everyone can see my screen again. Okay, so why are we doing this webinar? Like I said at the very start, there's obvious challenges post-COVID with occupancy in care homes. Occupancy is at its lowest level right now, and there's an increased rate of closure. So that obviously is leading us to do this webinar. There's also increased tasks for care home managers. As everyone knows who's on this webinar, is that you're having to deal with COVID testing. There's a lot more compliance issues that have come in, and there's just not enough time in the day to spend on occupancy. So like I said, what I'm going to do in this presentation is hopefully give you some tips and hints and things that can work in the background to help improve occupancy and help improve a waiting list. So when it comes to filling a bed, you're contacting the waiting list rather than having to wait for inbound people to come to you. And then I suppose public confidence, building confidence. So building confidence about your care home and building confidence just in the market about what happens in care homes. Obviously there was a little bit of negative press, which is completely unfounded. But let's get the word out there and tell everyone how much fantastic job we're doing in our care homes in the UK. So those are the challenges. I'm going to start by explaining the marketing funnel. I know it looks scary, but it's not. Hopefully by the end of this, you'll all be semi-marketing experts and you'll be able to talk me through the funnel. So the marketing funnel is really the basis of all marketing. No matter if you're in a care home, you're in a hospitality business, you're in a shop, this is how marketing is done. So number one at the top of the funnel is awareness, and that's getting people interested in the brand. And you think of brands that you know and you're aware of in the world, and I'll be talking about strategies that they employ to make you aware of what they do. So I'm going to try and get you guys to make your audience aware of what you do in your care home. The second stage is consideration, and that's called middle of the funnel. And that's to get you to stand out from the crowd and to allow people to think about you and pick you ahead of the competition. And then the third stage, which Isaac's going to take us through, is conversion, and that's encouraging action. So whenever someone's considering coming into your care home and considering maybe having a relative stay with you, that Isaac's going to take you through ways to convince them and ways to really market yourself to put you ahead of the competition. So that's it in a real nutshell in terms of the basis of marketing. So how I'm going to split this is I'm going to talk about the awareness, 5 tips in the awareness stage that you can employ right now. And then I'm going to talk about 5 tips in the consideration or engagement stage. And then I'm just going to take you through 5 tips in the conversion stage. So this is my motto when it comes to awareness: be found or be forgotten. It's very basic. If you can't be found online these days, then you're less likely to have occupancy in your care home. You need to have a presence online, and that presence can be in the form of many things, which I'm going to talk about throughout the presentation. I've looked at directories and things of care homes, and I've compared care homes. I've compared 10 care homes, and the ones that have pictures, the ones that have reviews, the ones that I can find and look around easily, are the ones that I would consider going to even visit. So if you don't have that, it's a real simple thing to do. If you don't have that and people aren't aware of you and they can't find you online, then you're going to be forgotten, unfortunately. So that will be the takeaway from this stage: be found or be forgotten. So most people think of, whenever they're saying be found, most people think of traditional methods. Like this newspaper ad here is fantastic. It looks great. It's in the paper, it's in a local paper, so you think it might be hitting the right audience, but it's really expensive. And there's free things that you could be doing with exactly the same, if not more, impact than a newspaper ad. So I'm going to take you through some of those free things that you can be doing. So the first thing is, if you don't have a free business listing on Google, you're missing out. So Google have a function called My Business, and this allows you to put photographs up. This allows you to put directions to your care home. This allows you to capture reviews and allows you to put your phone number in so people can easily call you. It almost can be used as an alternative to a website. And it's worth noting that 80% of people look online before making any sort of decision. So you think if you're buying something, you'll look online and research it yourself. You wouldn't just make a gun-ho decision and go into a shop and buy something. It's the same here. People want to see and get a feel for a product or a care home online first. So I put an example here. This is a care home in Bangor, where I'm from, in Northern Ireland, and they've done it really well. So as you can see here, they have photographs of the care home inside. They have photographs of the room. They have photographs of the lobby. They have a nice welcoming photographs of the care home manager. And straight away, I get a feel for that care home because I can find it online. I searched care homes in Bangor, and there was a couple of other ones didn't have such a good business listing as this. And I just thought this one stands out from the crowd. What they also do is they have social proof. Social proof is reviews. So they have 3 reviews here, 3 5-star reviews. So immediately I think, well, people are happy. Seeing those 5 stars automatically psychologically makes me think people are happy who have got relatives in that home, or who are in that home, or who work in that home. So it'll be somewhere that I would want to visit or potentially look at from one of my relatives. The great thing here as well is you have directions as part of your Google listing. And this allows people on mobiles, on desktop, to click directions, and it'll automatically tell them how to get there. So this is handy for relatives visiting your care home as well. So it's not just in terms of building occupancy. This can be handy, and this can be used for all forms of visits to the care home. And you can say over the phone, just Google us. You'll be able to find us on Google, and then that'll tell people how to get to the home. And just to emphasize, this is a completely free service that Google offer. Completely free. You can get walkthrough guides on how to set it up. There's different guides on what type of photos to put up, and there's different guides on everything. You can even put an FAQ section up here. So if you get loads of calls asking the same sort of questions, put those questions on Google and put the common answers to those questions on Google. You'll be surprised at how many people visit your home due to a Google listing. So anyone got any questions about that afterwards, more than happy to talk through it in more detail. Number 3, this is a really simple one, and potentially I'd say 90% of the people on here have their own personal social media page, whether that be Twitter, Instagram, Facebook, LinkedIn. I'm sure most people do have one, but I found a lot of care homes don't, and there might be some reasons for this. There might be consent reasons, there might be reasons that you just don't have time, but I'm hopefully going to give you a couple of tips to make it easier for you. So my first thing is pick one social media platform and do it really well. So if you have Twitter and Instagram and Facebook and LinkedIn, and you're doing little bits and bobs on each of them, just strip it down and pick one where you know that your audience are going to be. So if you want to appeal to relatives who are between 40 and 60 years old, Facebook's the platform for you, because that's where they go. And then one other thing on Facebook is, or on social media, is to be consistent with your tone of voice. So that's almost have one person who owns social media, and allow them to create their tone of voice. If the tone of voice is caring, professional, nurse, you could even write guidelines for that, and then make sure that they stick within that tone of voice, because people want to feel the social media. They want to have feel like they're having an interaction with someone real rather than just a platform online. Another thing is to create a calendar. So if there's things coming up, maybe you could share residents' birthdays or parties you're having, create a calendar with all those things in it. You can get a free calendar called Buffer, and this allows you to schedule posts. And you can do this. So for instance, you could hand this over to one of your staff and they could schedule all the posts on a Sunday evening. So then there's no more thinking about social media. You know things are happening there. People are becoming aware of who you are and what you do and what's going on in your care home. And again, just to emphasize, consent is really important here. Ask everyone to consent to being on social media. Ask the relatives to let your residents consent to be on social media, and ask all staff who join to consent to be on social media. So that's just a really important point. And start by building your audience by inviting all staff members and relatives. There's nothing worse than on social media talking to an audience of 0. There's just no point in doing it. So build up an audience straight away. So this is just a really good example. A care home in Yorkshire during the COVID outbreak, they used social media to communicate and connect with relatives. They didn't see it as a platform to share information. They actually saw it as a communication platform, which I think is really clever. You might have people in your care home who have relatives who are overseas, and they might not be able to visit physically their relative, and it would be fantastic for them to see a video of their relative, and you can use that on social media. Obviously, again, consent is key, but that would be a really nice thing for them to see. These photos, as simple as they are, with little bits of paper with writing on them, they actually got 8,000 shares on Facebook and were seen by over 1 million people. So imagine you could get your brand completely for free, seen by 1 million people. That would be the absolute ideal. I'm sure you would you'd find it easy to build a waiting list for your care home if you did that. Number 4, this is one less common talked about method of marketing. It's almost like a little marketing hack, and so I'm going to let you into a secret here. So enter awards. Awards act as fantastic PR, and what's even better than that, they're usually free PR. So they're an amazing way of getting your brand out there, while also rewarding your staff if you get the finalist awards. So you could bring all your staff, have a black tie event, you reward your staff, you also get your name out there. One thing I'd say is you don't have to enter care home specific awards. So I know there's care awards and things out there. You could enter local awards. If you are in a town and there's a couple of care homes, enter your care home for an award, whether it's staff member award, it could be anything, could be any sort of award. I know where I am, there's a Pride of Bangor awards, and I know care homes enter those awards. And the best thing about that is they usually get shortlisted, and that means they can shout about their brand. And the fantastic thing is you can share it on social media, you can share it as a newsletter, you can put the awards logo on your website, and this is fantastic social proof. Again, it lets people see that you're forward thinking, you're innovative, and that you're ultimately doing a great job and you're looking after residents really well. So another point on awards is don't be like Denzel Washington here. Don't worry if you don't win. If you're shortlisted, shout about it. Shout about it all day. Shout about it all for months. Talk about it. Like I say, put the logo of the awards everywhere. Say finalists in X category, and I guarantee that people will notice you. You will get fantastic PR out of it, and you will hopefully build a waiting list. Next one, direct mail. So most people think direct mail is quite old-fashioned approach to marketing, but actually it's really underrated. So what we know about direct mail is it gets opened and read. It's highly targeted because ultimately you decide who you're sending it to. If you know there's a region in your town that has an aging population, send direct mail to all of those houses. And you can find companies that can do this for as little as 15p per mailing, and they can get whatever you want. If it's a flyer, if it's just a letter, you can get whatever they want advertising your services. And again, it's highly personalized. People open letters, and I know I open letters because I get so few nowadays. So yeah, and also it offers great response rates. Direct mail, people will come back to you from direct mail. So I know from a marketing point of view for businesses, usually what they do is they have a return slip if they're interested, and if you want to get a little bit more expensive on direct mail, you can pay for a self-addressed envelope and ask people to send back if they're interested. And you know, if you do get a reply in the post, that person is very interested because they've gone to the effort of sending it back. So direct mail, don't ignore it, embrace it. On to the next stage. So on to the engagement consideration stage. And this is what I call standing out from the crowd. So if you have one takeaway, it's be found and be forgotten, and then stand out from the crowd. And that should define your thinking around this stage. So first thing in standing out from the crowd is build a database. And people say the word database and automatically get scared because it sounds so complicated. But a database isn't complicated. Database is effectively just a list. It's just a list of people's details that they've sent you inbound, and it's stored in some sort of regimented fashion. So you could have a database of names, addresses, email addresses, and phone numbers, and that's all you need to have, and that will be considered a database. So what I would suggest is start collecting these. Collect these from people who are interested in coming to your care home, and there's various different ways that you can collect these. You can have a form on reception. You can ask your receptionist to ask certain questions whenever people phone or are interested to input them into a database. There's many ways you can build a database, and we can get into that in the Q&A, or we can get into that post to webinar. So this goes hand in hand with building a database. Send emails. If you're not sending emails, you're missing out. Again, completely free method of communication. If you think direct mail is a step ahead, send emails. And what I would do is I would set up a regular newsletter. Set up a newsletter that you send every month to your database. The database can be full of residents and staff members, and this is a fantastic way to create demand. Tell people what you're doing in the home. Tell them when you have an open day, when you have a virtual event. Advertise using your database, and include calls to action. Have a button on your email and ask people to do something. It doesn't have to be anything major. It could be visit your website, leave a review, which then feeds into your Google rating and your Google listing. You can request things on databases and on emails, and you'll find that a lot of people will join your database because they're interested in what you're offering, and you will find that they will be responsive. So on to the next one. Oh, sorry, jumped the gun a bit. So if you're looking for a platform to send emails from, you don't have to do it from traditional email. You don't have to do it manually, send an email, one email at a time. I would use Mailchimp. If you hadn't heard of Mailchimp, Mailchimp is a free email sending tool. It allows you to create really beautiful templates, and it also allows you to input your database. So it can almost act as a little management tool, and allows you to send recurring emails. Great thing about Mailchimp is it's completely free up to 1,000 subscribers, and you can send up to 1,000 emails a month. So I wouldn't imagine many people would send more than that. So I would really highly suggest using Mailchimp. And to let you know, I'm not being paid by them. I just think it's a really great tool. Number 4 is host virtual events. This in the past, this time last year, or even 18 months ago, this would have said host events. But now we know we can really host virtual events, and I'm sure people can host events, but to be safe, I say host virtual events. The one thing about virtual events is it shows that you as a care home are really forward thinking and innovative. It's creative, and if you can't meet face to face, it's a perfect alternative. So invite prospective residents and family to virtual events. Get them to see the care home, and give them even a virtual tour. You could film a virtual tour on your mobile phone, and you could upload that, and you could invite them at a certain time to view the care home. That's a really fantastic way to try and get it out there without having people coming through the doors of the care home. And the great thing about that is, like this webinar, they can watch on demand. So they don't have to watch it at a time when you're in the care home. They can watch it whenever they like. And like, you could even incorporate that with your emails. So you could send a virtual tour of the home to an email database and pair some of these methods to try and get the best effect. Ignore this very grainy photo. This is a virtual afternoon tea. You can just about make it out through the pixels. So yeah, ignore this terrible photo I picked. But I found a virtual afternoon tea. This was a care home in the south of England. What they did was they got their residents together to have afternoon tea, and then they asked the people at home to also be eating afternoon tea at the same time. And it was almost like everyone was in the same room together. And they talked about on their blog how successful this was in terms of driving engagement. And also getting them people through the doors of the care home further down the line. Last one from me, and then I'm going to hand over to Isaac. So hopefully I haven't gone on too much. So partnerships, number 5, partnerships. So harness partner networks. If you get a referral, so if you think of it in your own life, if someone says, oh, I use this, you should use this, you will listen to people you trust. And you should really harness referrals. You should ask people to refer you and refer your care home to their friends. You should ask other organisations who maybe are also dealing with your target, your audience, to refer you. So we worked with Hallmark Care Homes a few weeks ago, and I know they were doing a great innovation with Barclays Eagle Labs, where they were doing a partnership. So they were both harnessing each other's brand and each other's offering. So Hallmark were talking about Barclays as a fantastic service, and Barclays were talking about Hallmark as an exceptional care home. Which I just thought was really creative and really innovative. So I'd start by knowing your audience and identify where they are, what they do online and what they do offline, and then trying to get partners with whatever they're doing. So that is me. Zoomed in a wee bit here, Isaac. That is me completely done. Hopefully everyone found that useful. So that was just the awareness and the consideration / engagement stage. And it was a real whistle-stop tour. We could get a lot more complicated, but we'll maybe leave that for a sequel webinar. So without further ado, I'll hand over to Isaac to take you through his 5 conversion strategies.
Thank you very much, Steve. Can you hear me? Can you hear me?
I can hear you. Yeah, I'm sure the audience can.
With your permission, I think I'm going to take another 5 minutes extra. I just want to add a few bits that following your presentation, which might be really useful for the participants that I believe. So in terms of Google listing, I think most of the marketing stuff you have said now is completely free, and we don't actually use it at all in the sector, which is terrible. And if the foundations are right, like you have a beautiful website, you have some good pictures, you have a nice Facebook page, that's all you need to set up using a professional. But apart from that, everything can be done within the house with some strategies. So Google listing, adding reviews. I think the Google reviews are more powerful than the carehome.co.uk reviews. So if you actually Google your care home, the Google reviews come up more than the carehome.co.uk reviews. So, and yeah, I think we'll talk about carehome.co.uk reviews later on, but all you need is a strategy. You know, every week commit yourself, get 5 reviews from your favorite clients, you know, favorite professionals, favorite staff. Just get them, you know, 5 each week. You're going to get like 30-40 in few weeks time. So I think you have to dedicate yourself to do that. The more reviews you have, people start to trust you. That's one thing. And in terms of social media, I think for a small care home or a relatively less than 5 care home group, I think the Facebook will be very powerful in terms of reaching out to the community. LinkedIn is effective only for recruiting the staff. So that's for brand awareness to recruit more staff. And again, having a screening process in-house is very important before you post anything in the social media. So you might have a social media champion. You want to screen it before you actually post something on the public domain. And you don't need a marketing company to do this. And I hate the marketing companies updating the social media profile, and it doesn't have a feel for it. So if your staff do it yourself, there is a genuine feel out of it. That feelings will come out through the words that's used in the Facebook post. So I would highly encourage one of your Facebook addict to be a social media champion and let them take over that. In terms of PR, I think local newspaper articles are very powerful. That just focus on the local newspapers. If you're a national company, then of course, like Barchester or St. John's Trust, then you will have to have a national media coverage. But otherwise, you just need to focus on the local media, and they are always hungry for news. All you have to do is just send them some article, 500, 600 words and some pictures. They're happy to post it for you free. So make use of that. In terms of direct mail, I think I'll tell you a secret. If you're really struggling for occupancy, this is a paid secret, but I'm giving it you for free. So if you're really struggling for occupancy, print a letter and post it to your local elderly housing population, and do it every week for next 1 or 2 months. I'm sure you will generate a lot of interest. And maybe partner with a local domiciliary care agency and ask them to refer to you as well, and pay them some kind of commission or incentive. And that's how you generate your interest. So do that. I have tried with many of my clients this trick and it has worked. Trust me on that. Referrals. Yeah, in terms of asking for referrals, I think we are not really good in asking for favor. So ask people, do you have anybody who can be referred to us? Just go and ask. If you don't knock, the door will not be open to you. So those are the few strategies I thought I should add it to Steve's content. Sorry for taking up time, Steve.
They're all good. I love everything you said there. Was completely right. And I love that little paid tip you gave about the housing associations. Very interesting.
It really works. Trust me on that. Okay, let's get into my topic. I don't like sitting while I'm doing the presentation, and that's true when I do the virtual events as well. So thanks for having me here, and I actually volunteered because I love to talk about this topic. And although my favorite topic is compliance, CQC regulations, and operations. Those of you who doesn't know me, my name is Issac Theophilos. The background starts from a carer, nurse, manager of a nursing home, 5-star rated care home. I started a consultancy. I am a care home consultant. I specialize in compliance. I worked with more than probably 150 plus care home projects and done more than 100 mock inspections. I help with operational support as well, the compliance, any business issues with care home sector, care homes. I tend to advise people on it and give them strategies on how to do it. And one of them is a bed occupancy issue, which is very, what I would say, it's a big thing at the moment. So I think the post-COVID, the care home will have to put a little bit more energy on their brand awareness and marketing awareness from now on. That's what I feel. I think those people who stand out on those kind of innovative methods to engage with the community, and they are going to be successful. Those who doesn't do anything will perish at some point, because occupancy is everything. That's your lifeline. So next slide for me, Stevie, please. So yeah, I think CQC has a beautiful way of using the colored light system for rating. So I think about, I take my daughter to school every day. Not sometimes, most of the time it's my wife, but sometimes I do take her. But and there is a traffic light in between, and whenever she reaches that traffic light, she needs to see that green man in order to cross the road. From a very childhood age, we are so, our brain is actually trained to follow at the traffic light system. And think about a person who is looking for a care home for their parent, and they are 50s and 60s, and they are very accustomed to this kind of system. As soon as they see a red, it's a no. They're not going to go to that care home anyway. And as soon as they see a amber, it's a caution for them. And if it's a green, yes, I will pick up the phone and speak to them. So CQC rating has a very big impact on your marketing efforts or your business success, I would say. So I think whenever you never go into inadequate, that's absolutely a no-no unless you have millions of cash as a reserve to pump in and get it back to right in 2 years time. Otherwise, the bad rating is not going to help you. And if it's a request improvement rating, yes, you can be lucky to still have more residents coming in. But I think post-COVID setting, request improvement will also be a challenge for the businesses going forward, because 80% of the care homes are good anyway. So why should people go to amber or red care homes when there's plenty of other places available? I think before it was a what do you say, buyer or seller market. I would say seller market, and now it's sort of like, more people are trying to stay at home, and their care home would be the last option. So why should they have to pay money to a lower rated care home to have the care for them? So the rating is very, very important. I think if you can get an external to audit your care home before an inspection, I would highly recommend you to do that. If you don't do it, you have to be very sure that you're going to get a green rating. So can I have the next slide, Stevie, please? I think there's lots of things to talk about, and I had to condense it quickly, and so that we can finish quickly as well. So I think knowing your customers. So let's call the people who are coming to us to live. They are the residents, and the people who are actually making the enquiry, let's call them customers or clients for now. Okay, so we had a confusion about what the terminology should be used in order to address them. So let's call them customers. So these are the common type of people who is actually ringing up to find out if you have a place. So elderly means it can be elderly couples who may be living together, and all of a sudden one of them went unwell and they can't be looked after at home anymore. So so when an elderly person look for a care home, the most decision factor for them would be that transportation between their own home and your care home. Is there a parking facilities in there? And is the manager or the whoever is listening to them, are they actually listening to the conversation? For some elderly people like to talk and talk and talk, and all we have to do is just sit and listen and empathize with them, and that's all they want, and give them a cup of tea and a piece of cake or whatever it is. So I think that empathy we really have to show to elderly people. I think when it comes to sons and daughters who can be aged between 40 and 60 years old, so these are a bit more well-informed people, I would say, and they know how to Google, and they know everything about your care home. They read your CQC report, and they want to know what the price is, and they want to know the facilities. Even though mom doesn't use the toilet, they still want to know if there is a attached ensuite facilities in the room. So I think every customer is viewing through their own eyes. So we really need to know, okay, this person, these are the factors that contributes to decision making. Hence, we have to put our words in such a way that they accept that this is the best place for them. I think it's not just giving the false promises. You have to deliver your promises. That's absolutely necessary. And sometimes you get grandchildren and nieces making calls to care homes to find out what's going on. So I think these people are more towards the modern type of setting. You have an Alexa in your care home. Do you have Wi-Fi connection, or how can I connect with my nana? These people would love to see their nana in doing activities in a Facebook page, a bit of more modern thinking, and those kind of things might attract them. At the end of the day, it's all about care. I think you have to provide amazing care so that you always retain their trust. That's absolutely important, and there is no compromise for that. And then you have the trickiest people, local authority and CCG. Trickiest people in the nice way, I would say. So meaning I think the decision making for them is sort of like a speedy process. So the quicker that we respond to their inquiries, then there is more chance for us to get through the door. So they will talk about local authority later. So these are the main type of people who might be inquiring to put their relatives into your care home. So if you know, I think what I would recommend is go back, think about these people, what are the decision making factors for each people, and then when you have a conversation with this kind of people, understand that okay, this is there's an elderly lady calling and this is how I should respond. Can I have the next slide, please? Okay, so the 5 strategies, I think I haven't invented any of them. I'm sure you are already familiar with this kind of techniques, but what I'm trying to say is I put it in such a way that if you intentionally do these kind of things, the success rate for your conversion would be far better than you unintentionally doing it. So the first factor is speed. Stevie, is there any chance that we can get some response from the audience or chat or?
Yeah, so there's a chat box. So if you ask the audience, they can just come back in the chat box or the question box. So if you've got any specific questions for them, they can get anything specifically you want to ask.
No, just to see, are we going in the right direction? If people are still online, yeah. Or
I can see everyone's still here, which is great. So that's a positive. That's almost good. Everyone's still here. Yeah, if anyone even wants to give us any feedback at this point, they can pop it into the question box or the chat box. Oh, someone's come back. Anna's come back saying great content.
Okay.
So
thank you.
We're definitely on the right line with Anna anyway. So thank you very much for that.
Okay. At least it's good for Anna. Let's do it for Anna.
Do it for Anna. Brilliant.
So yeah, fantastic. The first one is speed. So when I say speed, it means how responsive you are. I think the most people, especially the sons and daughters, they do work during the weekdays, and the only days they get off is during Saturday and Sunday. So these people will be actually calling you on a Saturday morning, and usually, if you ring any care home, if I can guarantee you that if you call 10 care homes during the weekend, probably 3 of them will answer and collect your details, and the rest 7 will say, the manager is not here, call after 9 a.m. Monday. So the minute you do that, it might be a disinterested staff who says, okay, call the manager after some time. The minute you do that, you're actually losing an opportunity of 40 or 50,000 quid for business over there. So if they're actually doing that, it's not their fault, it's the fault of the training that they have received. So it's something that you have to be really really pushing on, meaning training your staff how to receive calls, what to ask, what information to collect. And as soon as you get an inquiry, depending on how needy you are, you should inform the manager. The manager, whatever it is, call back in 30 minutes and get them on the phone. That's very, very important. I think it depends on how needy you are. If you are financially well and it's only last 2 rooms, don't worry, come back on a Monday or Tuesday, do it, that's fine. But if you really want to fill 10 beds, 12 beds, get on the phone straight away. That's very, very important. The second one, the quick pre-admission assessments. I think this is more applicable for local authority or CCG referred clients. And sometimes you get a call. I think at the moment all the assessments are done online. You will receive an assessment. You will get the assessments and you review it. And sometimes you may not have, in the pre-COVID times, people say, okay, I will come back and do the assessment on a Friday afternoon on my way home. It's a big no anymore, because you want to get to the phone and say, I'm ready to do assessment this afternoon as soon as possible, and I can tell you yes or no straight away. I think especially with CCG, those clients are ready to be discharged and they want to get out of the bed in the hospital as quickly as possible. If the person is continuing to stay in an NHS bed and it's costing them like 2,000 quid, 3,000 quid per day. So it's very important that these people need to transfer to the community, and there you are, you have a bed vacancy and your manager is actually saying, okay, let's do it on a Friday. It doesn't make sense. I think the earlier you do assessment, You do it on a Monday, and it gives the decision makers to process the discharge in a timely way so that they are with you before the end of the week. So it's very important that you are very quick in doing pre-admission assessments. The third one, yeah, this is a little bit tricky one, but one of my favorite. So matching the expectation method. By the way, I have never done this presentation before. I think I teach my clients who specifically ask for this, but I haven't publicly said these things before. So you're lucky to have it. Please go through this webinar again and again. So the first one is, for example, a relative come to you and say the person has a habit of waking up at 6 o'clock, having breakfast at 7 o'clock. They like to read the Daily Mail at 7:30 a.m. Okay, so don't interrupt them. Listen, listen, and listen. Let them speak out all their routine. Let them speak out all their, what makes them happy. And at the end of everything, you tell them, okay, we have a resident, Mrs. B, who does exactly the same thing, and she is fantastically happy here. And you actually show Mrs. B, and Mrs. B would say the same thing to that person. The credibility and the trustworthiness is increased. So hence, and you say, okay, can we do the same for your relative? Their obvious answer is yes. And if they say no, they will never say no, because who wants to hear no? They will say yes to your question. As soon as they say yes to your question, your next question would be, okay, when would you like me to do an assessment for you? So it's very important that as soon as you have somebody in front of you, you don't give them an opportunity to go and visit another care home. I'm not saying in a bad way, but it's important. Your care home might be great and you're looking after people amazingly well. Just use these strategies in order for you to get an assessment first before any other care home. Be selfish. Yeah, sort of like for your own job security, be selfish. Yes. I think I do not recommend you to give any false promises. And if you say that you're going to give cup of tea at 6 o'clock, give Daily Mail at 7:30, do it properly, please. Make sure that every day it's done. That's important. That's called matching the expectation method. Listen, respond in the same way. Yeah. The fourth one, Stevie, the star resident method. There's a bit of, let me have some water. This is one of my favorite one.
Just while you're drinking your water, we're getting some amazing feedback now. Ruth has started a hashtag, let's do it for Anna. I absolutely love it. And we have Sarah saying number 3 is 100% proven to work. Been doing it recently, which is amazing feedback. And then Anna herself is starting her own hashtags. Yes, we can. Let's do it. I'm loving the positivity. Loving the positivity, guys. Keep it coming on the chat.
Fantastic, fantastic. Thank you, Steve. I really appreciate those feedback. I think as carers and nurses, we never talk about money, or we don't like to. That's how we are brought up. But unfortunately, for delivering outstanding care, you really need buffer cash in the bank account. It's really important. I think whenever you have a downward cycle in your care home business, it's very difficult to get it back up again unless you have good cash reserves. So never go down on your resident numbers. That's very important. I think this would be a lifeline. If somebody follows this and they get a success, please feed it back to me and the team at Located Locum. We'll be very happy to hear success stories. So the star resident method. So I think this is a bit of unconventional in the care sector, but if you choose any sector, you will see the existing clients getting better deal if they refer someone else. We don't do this strategy in the care home sector. I think one of my clients did it, and they got loads of referral from the local community, and everyone is happy. So using this method, what you have to do is you have to choose your favorite resident who can really communicate how well they are being looked after there, how well that person is being treated, and you can call them a star. You offer them some kind of incentive in order to be part of the viewing and offering their advice and experience testimonial to potential residents or the relatives. So what you do is, I think post-COVID, I think pre-COVID, what you could have done is the customer comes in, you show them around, and you intentionally make that person sit next to this particular resident. And you say, oh, can you stay on there for a minute? I need to quickly address this before I come back. So by the time this resident do their job, meaning they will tell everything good about your care home. I'm not asking them to lie about you. You should provide good care for your resident to say the good things about you. So otherwise, nobody with good sense will say that. So make sure that you look after them very well. I think you can incentivize them. Most of the time, they don't want any incentives. They're very happy to sing your praises. It's entirely up to you, but make sure that you don't give them extra pudding or take them to parks every day. That would be a discriminatory approach. So do something in a less discriminatory approach so that you some kind of reward them for their active participation in referring people to you. I think you can use the same strategy for a relative who is very happy about your care and give them some kind of incentive or reduction in 1 week's fees. People are really happy. They could do some kind of things with the money that they saved. So it's called star resident method or star relative method. So be very intentional with this, and it can work. It can really work. So the next one, please, Stevie. Yeah, the team strategy. I think all the things that I have mentioned, I think most of the care homes, it's usually the managers who show people around. And so sometimes in some setting it would be admin. In bigger organization it will be some kind of facilities manager or business development manager. Regardless of who it is, usually it's one person showing them around. You can change the strategy by involving all of your team to be part of the viewing process. So that means the nurse will tell the particular relative that these are the things that as nurses we do here. The chef will show the kitchen and show them how the menu is chosen, how things are decorated. They celebrate the birthday, they make the cake, how different days are celebrated, and all those things. I think you can even include the activities man or the maintenance man who is involved within your business. Let them all share the same feelings. And when the same people say that, okay, different people say the same story, there is a high chance they will try to believe that. So it's called team strategy. I think it's all about reflecting their feelings from multiple people. So, and sometimes you can even pick the appropriate staff to do the viewing for that particular resident or the relative. So you can really select who should be doing the viewing for this particular resident, because sometimes they may not like my face, they might like my colleague's face better. So they will have a better rapport with them. So use them. It doesn't have to be yourself who needs to be the front of the show. It can be other capable people within your business who has got empathy, who has got more feelings, who can develop that emotional connections. So it's very important that you develop I think anybody who wants to select a care home, it's an emotional decision. I think if you stand there without any emotions, without smiling, they're going to walk out straight away. So your emotions and feelings should come out and empathize with them. I think we already discussed 5 strategies, but I think my numbering is wrong. The first one is speed. The second one is what was the second one, Stevie? I think it's a quick assessment. The third one is matching expectations method. The fourth one is the star resident method, and the fifth one is the team strategy.
Don't worry. Yeah, everyone got that, I think. And then yeah, that was the 5. We had some questions come in, which we'll get to. Do you want to close off, Isaac, and then we'll get to the Q&A?
Yep. I think the thing to remember is, as care homes, we never had to advertise before or use this kind of strategies in order to get clients for or on our list. I think you may feel awkward to do this kind of process, but there's nothing awkward about it. You are providing an amazing service, and you are using some technique and skills which is used by many other sector in order to get clients for yourself. I think don't reject admissions, approve admissions, find ways to care for people. Hence, you are actually creating jobs, you're retaining jobs, and your company can invest more money into delivering better care. Like I said, always said, outstanding care is only possible when you have cash reserves in the bank. Thank you very much. If you want to get in touch with me, you can search Issac Theophilos, any of the social media. And yeah, I am on the end of the phone.
Perfect, Isaac. Isaac, if anyone wants to speak to Isaac directly after the post, the email follow-up, I will include links in social media. So don't worry about making notes or anything now. You'll have it all in your inbox tomorrow.
Thank you.
So yeah, just to sum up, obviously the reason Locum are doing this webinar, we are operating in the care home space, and this was something that was highlighted to us as an issue of the occupancy. We have some care home clients. This is one of them, and you know, they made a comment that Located Locum themselves helped drive the care home market for 10 years, which is amazing feedback for us. A lot of it comes down to time saving. So what we do as an organization is try and give care home managers and operations people in larger care home groups more time to get back to delivering care and also thinking about occupancy. So the products I took you through at the start are an example of that. One particular product we do is the bank product, and it helps to grow your direct bank pool, and saves you guys time on chasing people to or spending money with agencies through technology. So if anyone's interested in anything that we do as an organization, you can definitely get in contact with us, and we'll be more than happy to answer any questions. And likewise, anything that I covered is from a marketing angle, I'm more than happy to answer any questions care homes have in more detail, or if you need a couple more hints and tips on how to get the best out of your marketing, your awareness and engagement stages. So we will jump into Q&A. There's actually been some questions while we've been chatting there, which is fantastic. We've had a couple more hashtags as well, which is great as well. We love a bit of engagement on these webinars. If you're giving up your time to watch a webinar, you may as well engage. That's what I always say. So it's been great to have so many people on and so many people engaged. So yeah, so okay, question for you, Isaac. This is from Susan. Such a positive discussion. Could you talk about how to engage negative staff, as sometimes staff can be hesitant about selling the home?
Sometimes staff are negative about what?
They can be hesitant to sell the home on your behalf.
So do they have to work for you then?
I'm not sure. Ruth, do you want to come back on the chat to that one? Yeah,
I think the answer, that was my answer to that question. You know, if somebody is not in line with the mission of the care home or the business that we are running, should they be in the business?
Yeah, that's a fair point.
Yeah.
Okay, Ruth, if you want to expand on that any more, then we are happy to talk about it more. So yeah, Susan says, Susan just said, such a positive discussion. Sorry, Ruth said, has this session been recorded? I would love home managers to hear this. Yes, it has been recorded. It'll be in your inbox tomorrow, and it'll also be listed on YouTube as a private link. So you'll have a link to that, and you can show it to all the care home managers in your organization. And that's that one. Just Karen giving some amazing feedback, just saying it's great to always to listen to your ideas, Isaac. Yeah, Lindsay, another more amazing feedback, simple ideas but so effective. Thanks, guys. Sarah agrees with your point about do they have to work there. It's great. Yeah, Ruth, that's perfect. Anyone got any more questions before we wrap up? Anything at all? I'll give you 30 seconds. Just while we're Isaac, Sarah is asking, do you have a mock-up of the letter you send to housing associations about occupancy, or any sort of examples?
Yeah, of course, I can write one for them on a paid basis.
Okay, Sarah, so get in touch with Isaac after. Yeah, okay, so that's all the questions by the looks of things. Oh, someone's asked, this will move for you, Jeanette, how can we have a look at the Locum platform?
Well, I'm happy, obviously, for you, Stevie, to pass my details on when you're sending out the information tomorrow. But I'll also be following up with people anyway, just to have a chat about the webinar after this. So we can arrange a demonstration. There's no problem with that.
Perfecto. Great, thanks, Jen. So yeah, that's us, guys. Thank you all very much for attending. Like I say, everything will be in your inbox tomorrow by lunchtime. And do you know what? If you've got any ideas about webinars in the future, anything like this actually came from a suggestion from a previous webinar. We'd seen the challenges in the market, and someone suggested we touched on this, and we put it together. So always very happy to create content based on the needs of you guys, because otherwise what's the point? So yeah, let me know any discussion points. We can get Isaac back for round 2. Isaac, you're keen. So yeah, thank you very much, guys, for attending. It was great to have so much interaction, and yeah, that's me. Thanks for giving up your evening. Isaac, do you want to close off, and Jen, you want to say bye-bye?
I think, yeah, guys, I think Steve has been working with me for last 2 weeks in order to set this up. So if you're intending to look at their the platform, please do, because they have put some effort to organize this, and I put some effort to prepare for this. So give something back, have a look at their platform, at least be aware of these things. So that's how you get the value back. Oh, thank you. Yeah, thank you for attending today.
Thanks, Isaac. Perfect, appreciate that. Jen, do you just want to close off?
Yeah, guys, I find this really interesting, and I actually got quite a lot from it, so thank you. It was really informative, and thanks for the shout out, Isaac. Feel free to tell all your 150 care homes that you speak with on daily about Locum as well. So yes, thanks very much, and good evening or good night.
Brilliant. Thank you very much, guys. We'll close it off. We just had one last comment that said, best webinar I've attended this year, which means a lot. Takes a while to put these together, but they're worth it whenever the audience love it. So thank you all very much. Good night.
Thank you. Good night. Yeah. Always.